Today we're going to talk about dysautonomia. October is Dysautonomia Awareness Month. And as part of dysautonomia, we are going to talk about dystonia and CRPS. Dysautonomia is a neurological condition. So I'm going to do a quick review of the neurological system. As we know, CRPS is a neuropathic pain disorder. It causes autonomic dysregulation, a nervous system disorder that disrupts the autonomic body processes. So, what does the autonomic nervous system do? It's a component of the peripheral nervous system that regulates involuntary physiologic processes, including the beating of your heart, your blood pressure, respirations, digestion, and sexual arousal. It is part of the peripheral nervous system, which is everything else and includes that impulses that travel from your spinal cord and brain to supply your face and the rest of your body. The autonomic nervous system regulates unconscious bodily actions. The enteric nervous system can operate independently from the sympathetic nervous system and the parasympathetic nervous system, but it is influenced by them. It includes a mesh of nerves that envelop the digestive tract. It operates independently from the brain and spinal cord. It controls the digestive enzymes and the motility of digestion. Parasympathetic has activities that occur in the body at rest. Complementary to the sympathetic nervous system, the peripheral nervous system arises from the central nervous system. Sympathetic nervous system. This is the fight or flight component of the autonomic nervous system. Originally, it was thought that CRPS only affected the sympathetic nervous system, thus it was called reflex sympathetic dystrophy. However, once centralized, we now know that it affects the entire autonomic nervous system. It is constantly active to maintain homeostasis, which is a balance between different elements in the body. And it is a major role in various physiologic processes, such as blood glucose levels, body temperature, cardiac output, and our immune system functioning. So, what is dysautonomia? It's a failure or defect in the autonomic nervous system, in which the autonomic nervous system does not work properly. This may affect the functioning of your heart, bladder, intestines, sweat glands, pupils, and blood vessels. Dysautonomia has many causes, not all of which are classified as neuropathic, but we're going to talk today about the neuropathic. In those with CRPS, dystonia can cause many comorbidities or associated illnesses. In the cardiovascular system, it can cause POTS, which is postural orthostatic tachycardia syndrome, which we discussed in a previous show. The bladder can cause inability to initiate urination. Digestion. The digestive system can slow down, causing gastroparesis, which we will cover in the next show. Movement disorders. About 25% of all patients with complex regional pain syndrome suffer movement disorders, including loss of voluntary control. Bradykinesia, which is difficult in initiating movement. Dystonia, which is involuntary contraction of muscles. Myoclonic, which are brief involuntary involuntary jerks, and tremors. These movement disorders are generally difficult to manage and add considerably to the disease burden. We also find that we have excessive sweating, inability to maintain our body temperature. Blood flow to the affected limb causes skin color changes and the shiny appearance. And in the brain, it can cause brain fog and balance issues. So, dysautonomia is a movement disorder. It can affect a single muscle, a group of muscles, or the entire body. It can be a primary condition or a symptom of other conditions. Some cases worsen over time, while others are mild. Dysautonomia is a neurologic disorder that causes involuntary muscle contractions, resulting in abnormal postures, repetitive movements, or twisting. Symptoms can include tremors, voice problems, dragging of your foot, overextension or overflexion of the hand, inversion of the foot, which is turning in, lateral flexion or reflection of the head, inversion of the foot, torso of the spine, forceful closures of the eyes, and a fixed grimace. The first line of treatment for dystonia are antispasmodic medications such as baclofen or muscle relaxants. These can be taken orally, but they can also be administered by an intrathecal pump. If you think back a ways, we did talk about the surgically implanted intrathecal pump. Antipsychotic meds such as Lamictal can help when taking a muscle relaxant or an antispasmodic fail. Botox injections can be used on a group of muscles. This can't be used on those who are immune compromised. Sandy, who did our scrambler presentation and is a mom on our mom panel, found that scrambler therapy helped with her dystonia. So what are some other ways to treat dysautonomia in CRPS? Okay, we've outlined how POTS is treated. Swelling, temperature changes, and skin changes. There's not much that can be done to treat these. Tremors. I had hand tremors early on that were treated by medication, Inderal, which is a beta blocker. Voice problems. I have a friend whose vocal cords were paralyzed by CRPS, and getting IV ketamine helped her vocal cords to function again. Dragging foot. In some cases, tendon surgery can help if medication fails. In some cases, Botox injections can help, but they should never be used in those who are immune compromised. Overextension or overflexion of the hand. In some instances, tendon surgery can help if medication fails. Inversion of the foot. Muscle relaxants and antipsychotics often help. In some cases, again, Botox can be used. Lateral flexion or retroflexion of the head. Muscle relaxants, antipsychotics often help, and if not, Botox injections may help. Torso of the spine. Muscle relaxants, antipsychotics, and Botox injections can all help as long as you're not immune compromised. This is inversion of the foot and curling of the toes. So today we're talking with Denise, and we are talking about medication pumps. So I know that you got a medication pump for a completely different reason that I did. Yours was for spasticity and dystonia. Can you tell us what year we're talking about when you were diagnosed?
I was diagnosed in 2001.
Okay. All right. And can you briefly tell us how the pump itself enhanced your life?
Yes. Basically, I'm able to walk a little bit better than that, better than I used to be able to walk. Um, the spasticity and more importantly, the spasms that I had basically were in my back and my legs.
Yeah.
Um, really caused me to, I would say, bend over and totally what's the word I want to use? Totally, uh, I'm sorry.
Okay. I get those now,
Yeah,
but nothing to do with my CRPS.
yeah, totally. I guess lock up or whatever
Mhm.
you would say, and take my breath away. Um,
And did you start on oral?
yeah, yes, I did. I was on baclofen. I was on tizanidine. I was on dantrolene, and at various points, I was on two of them at a time.
Right.
And it made me very tired.
Yeah. And
And
it probably didn't help as well either.
exactly, exactly.
Yeah.
So we eventually decided to go with the pump.
Yeah. Dr. Schwartzman did that with a lot of people.
Yes.
So perfect. And then I have one other question, and that is how ketamine infusions have added to your quality of life.
They have helped unbelievably.
You want to like
Since
tell us a before and after type of thing that it's helped with?
um, beforehand, besides pain, it
Mhm.
has helped with my pain unbelievably. Um, I'm able to move around a lot more. Um, able to help out in the house a lot more. I'm still not able to do, a whole lot, but I can help out a little bit more in the house. Um, I'm able to do more with the kids. My kids are grown, but I can do things
They
with them.
probably weren't back when he started the infusions.
No, I actually didn't start my infusions until 2013. So
Okay.
I'd had it for a long time
Yeah.
because of insurance reasons.
Right.
I couldn't do it. Um, so I wasn't able. I still participated with my kids, of course,
Right.
but I didn't start till later on. But one main thing that I noticed soon as I started with my ketamine infusions, I was very, very, very swollen. Um, with my CRPS. But as soon as I started with the ketamine infusions, the swelling went down. Um, and it has remained down. I mean, I still get swollen before my infusions, but nothing like they used to be.
Right.
My legs were massive
Yeah.
before I started my
Well, that
ketamine.
in and of itself will help you move around more, not to have the swelling.
Exactly, exactly. Getting any kind of shoes on before was next to impossible.
Yeah.
But now I can wear shoes.
Well, that's cool.
That was a big thing.
Yeah. For me, it worked best on the allodynia. I couldn't
Yes.
wear clothes before I started ketamine. I would wear a
Yeah.
sundress or shorts in the winters of Pennsylvania.
Yeah. I can understand. Still, the allodynia is tough for me, and I can only wear sweats and really soft t-shirts is all I can do at this point still.
And
Um,
it's just so interesting how two people with the same disease, it affects them differently.
right.
I mean,
It's
it did
amazing.
help with my edema. Before ketamine, my primary is like, oh no, you must have a cardiac issue because you're so swollen. I'm like, no, I don't.
Right. Exactly.
And to make them happy, I let them do the blood work. So they
Right.
stopped bugging me. And of course, it was normal.
Yeah, they kept doing Dopplers to see if I had DVTs.
Right.
And I'm like, no, it's just the CRPS.
Yeah. Yeah. All right. Well, thank you so much for your help.